So, the big news story over the last 24 hours pertains to the United States government, pertains to the US government's relationship with the World Health Organization, which is the international body and UN agency that advises the world on handling health crises. US President Donald Trump has said he is going to halt funding to the WHO, the World Health Organization, because it has, quote, failed in its basic duty and must be held accountable in its response to the coronavirus outbreak. Essentially, the President of the United States is deflecting blame in many ways, saying that the World Health Organization misled the American public and indeed the world, and this is why the coronavirus pandemic outbreak has gotten so bad. President Trump accused the WHO of mismanaging and covering up the spread of the virus after it emerged in China. Now, this withholding of funds is a significant matter because the US is the global health body's largest single funder, and it gave more than $400 million in 2019. A decision on whether the US will resume the funding will be made after a 60 to 90-day review by the Trump administration. In response to the US government's declaration, the head of the World Health Organization, Tedros Adhanom Ghebreyesus, said that it was, quote, not the time to cut the funds to the WHO. He also said, there is no time to waste. The World Health Organization's singular focus is on working to serve people, to save lives, and to stop the COVID-19 pandemic. Other politicians in the policymaking circles have been highly critical of President Trump's claim and also President Trump's proposed policy to cut funding. Senator Patrick Leahy of Vermont, who is the top Democrat on the Senate Appropriations Committee, said in a statement that the move, quote, makes as much sense as cutting off ammunition to an ally as the enemy closes in. Leahy went on to state, the White House knows that it grossly mishandled this crisis from the beginning, ignoring multiple warnings and squandering valuable time, dismissing medical science, comparing COVID-19 to the common cold, and saying, quote, everything will be fine. Not wanting to take responsibility as the deaths continue to mount, he blames others. These are Leahy's words about President Trump. Yet other articles and experts have wondered whether President Trump is actually embarking on a sound policy and whether he is actually taking the appropriate course in cutting funding from the WHO. An Atlantic article published by Kathy Gilsinen notes that statements made by World Health Organization leaders almost literally echoed the Chinese government's statements on the coronavirus. This is a direct passage from the Atlantic article. The most notorious example came in the form of a single tweet from the WHO account on January 14th. Quote, preliminary investigations conducted by the Chinese authorities have found no clear evidence of human-to-human transmission of the novel coronavirus. End quote. That same day, the Wuhan Health Commission's public bulletin, and again, the Wuhan Health Commission is the main body dealing with the pandemic in the former epicenter of the coronavirus, Wuhan. The Wuhan Health Commission declared, quote, we have not found proof for human-to-human transmission. But, as the Atlantic article notes, by this point, even the Chinese government was offering caveats not included in the World Health Organization tweet. This is another direct quote from the Wuhan Health Commission bulletin. The possibility of limited human-to-human transmission cannot be excluded. but the risk of sustained transmission is low. This, as the Atlantic article points out, was catastrophically untrue. And in the months since, the global pandemic has put much of the world under an unprecedented lockdown and has killed more than 100,000 people. According to your own research, is the Trump administration proposing a sound policy in potentially cutting off funding to the World Health Organization? A second question for you to consider: if the Trump administration indeed pulled funding from the WHO, what would the potential ramifications be of this policy? Those are your two questions for today.